helping people really reach optimal levels of health by getting in deeper to what is going on with their aging. And this is what's so important, these underlying causes of aging. So we've been really working in bringing the best of integrative medicine, the best of conventional medicine, and the best of natural based medicine, bringing it both together. As a nurse practitioner for many years in community clinics, I've seen these chronic diseases. And I also see that the way that it works in medicine right now is disease based and disease driven. We're looking at the reference ranges, and if the numbers go over the reference range, that's when we pinpoint a problem. And as I was in this conventional side of medicine, with always the thought that the body has a natural way of healing, if we could just give the body what it needs and take away the obstacles that the body has in its healing process, then the body has a tendency to come back to normal if we can just give it what it needs. And a lot of that can be natural based and can be food based, targeted nutrients, and foods and eating well. And what does that mean, eating well? Well, it's very personalized and very individualized based on these underlying contributors of aging. So what's so different about the way that we work is we look for the root cause. We're not just looking to see what is the disease when it reaches over the limit in the reference range. We want to see where the trends are going. We want to see if there are these tendencies for the body to be under inflammation, poor liver detoxification. We really look into the mitochondria because the mitochondria produces ATP, and it uses our food and combines it with oxygen to make ATP energy. Now, in that process, many things can go off, and it requires quite often these very active nutrients, B vitamins, minerals, amino acids that are involved in this mitochondria producing energy. And we really want to dig deeper and see the health of the mitochondria. And that is something that is very important here in our integrative medicine center. We also dig very deep into gut health. We've seen the research over the last 25 years, being that we've been in functional medicine and regular medicine for 25 years. We can put it both together. We can understand diagnoses, pathology, reading lab work, and diagnostic x-rays and ultrasounds. But we can then look for more natural treatment plans, and we can also be preventative. And many of these chronic diseases are reversible and preventable. But what's so important is to get to the root cause, not just look at the disease and the medication that's typically given for the disease. And that is important at times. There are times when you need urgent care, antibiotics, steroids, but there's a time then when we want to look also at the root causes. What is going on in these conditions, that we can look at the biochemistry, how the body is working, and support the body through food, targeted nutrients. And if we see that there's a compromise, we see that there's a dysfunction in, let's say, the hormones and the way the hormones are communicating to one another, the thyroid hormones, the sex hormones, sometimes they can be blocked. It doesn't mean that it's actually low. It means that it's being impaired, it's being blocked. And we look for that. We look because we know that sometimes it's not just getting the number of a lab test. It's asking the question, why is that number there? Why is it low? Is it possible that these hormones are just not being converted right to its active form, which requires vitamins and nutrients? Or can it be that there's some inflammation that also blocks these hormones from working effectively? So we look deeper into hormones, hormone communication. And as we know in modern medicine, thyroid disease isn't picked up until there's already a pathology, until it's already over the limit, and this is already too late. And we really want to work also on these scourge of autoimmune conditions, and we can help with that, not by curing autoimmune, but by lessening the symptoms, lessening the amount of times that there's exacerbations or reactions, by digging deeper into what was the cause, what are some of these contributing factors into autoimmune. often we find nutritional deficiencies or insufficiency. We see latent infections. We see poor gut health, gut dysbiosis, and other factors such as toxins and mold. But we get to the root cause, and that's what's so important. So remember, if you really want to be preventable and reverse these chronic diseases, don't just put a Band-Aid on it and look for that easy way out, the easy IV of nutrients, the easy peptide that you're going to inject. Those are all good at times, but make sure you're getting to the root causes and the underlying causes. And that's what we are focused in on here at South Florida Integrative Health Center. Yes, we have the latest peptides, NAD, semaglutide, but we always work with each individual patient to make sure that they're optimal before we give them that that quick and easy solution. So what's so important is get to the root causes, and we can help you with that. Reach out to us. Our website is right there, South Florida Integrative Health Center. You can make a discovery call and you can see how we can help you. Everyone have a healthy, happy day.